This is week 2 of our month-long series on vector-borne infections. Today we're going to be talking about different testing options so you can get an accurate diagnosis. Made to be Whole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on Made to Be Whole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing. So we're going to dig deeper into the world of testing for vector-borne infections and why you need to be a pretty savvy consumer when it comes to this. So there's a really good documentary that I would recommend. It's called The Quiet Epidemic. The last I checked, it was on Amazon Prime and on Apple TV. I think it does a really good job of diving in a little more detail into why some of the testing that's most commonly available isn't as accurate. And the woman who does it, she's a journalist, so I think she does a good investigative instead of inflammatory approach to the topic, which I appreciate. You've got to watch with some documentaries. They can be inflammatory. I remember watching one with my daughter and it was on Lyme disease, and she just said, "Mom, they make us all look crazy." So, be a savvy consumer, but I do recommend The Quiet Epidemic. So testing-wise, we will start with testing for Borrelia burgdorferi, which is Lyme disease. It's interesting the way testing gets used, I feel like, as a weapon in our medical system. So I've seen this happen a couple of ways with this category of diseases. So I will have patients be told, well, you can't have Lyme or whatever else it is. Usually they're not testing for the other stuff. You can't have Lyme because you have a negative test. But then I'll have people who have a positive test with those regular hospital tests or 2 positive tests, and they're like, it's a false positive. So basically, people are screwed. Because you have a part of the medical system that's made up its mind that this isn't a real thing, and no matter what the patient does or presents. And I get especially frustrated because I remember when I went to nursing school, and this was just even as an undergraduate, they drilled into our head that your most important diagnostic tool is a good history and physical. Clinical diagnoses are so critical. You need to listen to the patient. And I feel like that's been flipped on its head right now, where you have a patient who will come with a thorough history with really compelling evidence of whether it be these infections or other things, and you have a healthcare system that relies so heavily on testing, but then again is selective about the testing that we'll even pay attention to. I actually had someone tell me once that some infectious disease doctors don't believe in one of the tests that I'm going to discuss with you. And I thought, what the heck does that even mean? They don't believe in it, like not believing in the tooth fairy. I mean, it is an excellent test. It's Medicare approved. It is accredited by the College of American Pathologists. I mean, to me, there's just a lack of intellectual curiosity if you're not willing to look and say, oh, there are new things available that weren't there when I went through medical school or nursing school. Why don't I do a little investigation? Now, maybe you investigate and you still decide you don't like to use that, and that's fine. But just willful ignorance drives me absolutely bonkers. So when to test and why. So we talked last week about some of the infections that can present as Lyme disease, like especially this migratory arthritis, chronic pain, chronic fatigue, neurological symptoms. You want to get tested. So if you're going to ask a provider to test you using the regular hospital tests first, here is my recommendation. So there's 2-tiered testing, which is they look at the total amount of antibodies, and then if that is high enough, they'll reflex to what's called the Western blot, which looks at specific groups of antibodies. Antibodies being proteins your body makes when it's been exposed to something. So, if you find someone who's willing to, I recommend against the two-tier testing because the way the first tier goes, where it's looking for total I can't talk today, number of antibodies, it just says positive or negative. So, say a positive, we'll just throw a number out there, is 80. And you could look and see, well, this person's not an 80, but they're also not an 8. They're a 78. That's a pretty convincing number to dig deeper. But then also you could have someone who has a very specific antibody pattern that makes a compelling case for Lyme disease, but they don't have really high numbers of antibodies because their immune system's not working as well as it should. So the test can be ordered not as two-tiered. It can just be ordered as the total antibodies plus the Lyme line blot. It's written in some labs. Or what I do, because if I write it that way, sometimes the labs just ignore me and just do positive or negative. So I usually just write it for Lyme line blot or Western blot, depending on the lab you're using. And then that gives us a picture of if what exposures might have been there. So they've got these different bands, BADNS, that are numbered, these antibody bands. And I don't know where the numbers came from. I don't know why they're not chronological, but there are certain bands that really are specific for Lyme disease. So, like band 41, not specific. There are a lot of other infections that can trigger a positive band 41. Band 23, very specific. So somebody could have a weak antibody level response, but if they've got a 23 and a 41, we've got to look at this. One of the things that is missing in this approach, though, is you have bands 31 and 34. 31 and 34 are very specific for Lyme disease, meaning other infections aren't going to make them positive. Well, there was a point in time 30 years ago or so when they were making a Lyme vaccine that would have triggered those to be a false positive, meaning if I had had the Lyme vaccine and then I got tested for Lyme disease and thought I was sick, band 31 and 34 would have been positive because of the vaccine. So instead of thinking that maybe we were intelligent enough to ask people if they had had the vaccine and disregard that, they just took it out of the test. And even though the vaccine never came to fruition, it never waded its way back into the test. So you could have someone with a negative Lyme blot, but they have a positive 31 and 34 that's totally diagnosed. So if you get tested for Lyme disease through this traditional test and you test positive, I would actually consider yourself pretty lucky because that's the least expensive way to get it done, especially if you do have insurance and a provider who will order. But how is it then that people who are sick could have a negative test? So we talked about a few reasons. Poor antibody response, your immune system's not working, you don't make enough antibodies. You actually would have been positive, but it's a test that doesn't catch 31 and 34. Or what if you have borreliosis, you have a Borrelia infection, but it's not Borrelia burgdorferi that they're testing for? What if, like we said last week, you don't have red delicious apples, but you have other apples? So the way the system's set up, people say, "Ah, you don't have red delicious apples. There are no apples here, no apples here." Well, clearly there's an orchard of apples, but they're different kinds. So you have to use some specialized testing. And now I'm going to skip real quick to like my opinions, which I believe are based in fact, about your traditional lab testing for Bartonella and Babesia. I I have very, very rarely, I mean, I have a few people who have had positives from the traditional hospital labs, but unless you have an insurance plan that's gonna pay for those 100% and you wanna try that first, I don't even think it's worth your time and money. Babesia, typically the hospital just check for like Babesia microti or Duncani when we know a lot of chronic infections are being driven by Babesia otocoeli or divergens, so they're not even testing for those strains. Also with Bartonella, it's just flawed. You don't need to hear about why. I've had like 2 people come back positive. and many, many people come back positive on other more sensitive testing. So, main takeaway is it's fine to do those tests, but if it's negative and you feel like there's something wrong and you have symptoms that match, I really recommend looking for better testing. And I'm going to go through some of those options and how you can access them as a consumer. So, there are two types of testing. There's indirect and direct testing. Indirect testing is checking for antibodies, like we talked about. Antibodies meaning there was an invader, your immune system made these so that it recognizes it when it comes again. So that's indirect testing. You're not actually finding the Lyme bacteria or the Babesia parasite, but you're finding evidence that it was there, kind of like its footprints. And antibody testing can be very good for some people. People that it is not usually as accurate for is anyone with an autoimmune disorder, anyone whose immune system is suppressed by not just disease, but by medication. So, a lot of people who have illnesses that can, whose symptoms mimic that of some of these other infections like rheumatoid arthritis, multiple sclerosis, some of our neurodegenerative diseases, maybe on treatments that suppress your immune system. And because of that, your body's not going to make these antibodies. So it doesn't mean the infection is not there. It means that the antibodies aren't there. So those people need to rely on a more direct form of testing. I'm going to talk about direct testing first. My favorite option for direct testing is fish testing through a company called TLAB. The T is for translational. So their website is TLABDX, D like dog X.com. The thing that's beautiful about this test is that it will actually send you pictures. They use, so it's fish testing, which is fluorescent in situ hybridization. And so they will actually send you images. They're looking for the RNA of the parasite or the bacteria, and they will send you images that they get as they look for this. They use what's called confocal microscopy, which is a really basically super powered microscope. I think they're beautiful pictures, and I love the affirmation that my patients get when they can actually see instead of just a positive or negative, like, oh, no wonder I don't feel well. Look at that. That's proof that it's there. It's very, very affirming. The other thing that's nice about that test is we can use it as comparison like, farther down in treatment, so, like, maybe we treat you were positive for Bartonella, so we retest in 6 months and it's still there, but boy, it's not as there. So, I mean, it's not a quantitative test because they're just looking at that sample and sending you representative images of it, but it gives us a good visual if we're heading in the right direction. And I also think it's amazing because it used to be people decided when to stop treatment based on when symptoms were better. Like initially, the way I was trained was once people are symptom free, treat for another 2 months, then you pull the treatments and you watch, because they should be low enough then that they're going to hopefully stay well. Now we take the guesswork out of it. We can look and say, a couple things like, some people just wanna treat until they get negative tests, which I think is absolutely fine depending on your situation. Other times, people are like, I'm fed up with taking all this stuff," and we check, and it's like, "You know what? It's still there, but it's much, much better. Let's back off. Let's be more aggressive. Let's do some mild things to manage this. Watch your symptoms." But then I had another case where I had 2 family members who had been treated for very severe disabling Babesia infections for a year were feeling much, much better, like back to functioning in society, not 100%, but feeling better. We had done antibody testing at the beginning. So after a year, we did this fish testing, and holy cow, that was not the time to really back off because there was still such a high load that if we would have backed off too much, they would have very quickly been right back where we started a year ago. So I don't want to take that chance with their health. We still made some adjustments, but it's very very affirming. And the other super cool thing that TLAB does is they do what's called biofilm testing. So, what makes infections chronic is your body makes biofilms, which is like this is a very oversimplified explanation, and they are made of different materials, but I think of it as like slimy armor that's just trapping infection there, you know? So if you've got it in your blood vessels, you've got biofilms that are holding it in there. So we may be doing beautiful treatments that clear everything that's floating around, but then if you've still got stuff trapped in there, it's gonna eventually come out and you're not gonna stay well. If you treat adequately and you feel well and you stop treatment and then your symptoms are back months later, it's because there are biofilms. So you actually have a way to look at the biofilms. And when we did this for my son Matthew, we did the biofilm testing. He looked at the results. He's like, "Holy cow, no wonder I feel like bleep." You know, it it's affirming, and what's fascinating for him was just to show you how these affect you. Before we did this pretty aggressive treatment targeting the biofilms, we had been doing things for them all along. He would, if I drew his blood, a huge section of his arm would turn literally black and stay that way for a couple of weeks. It was just really alarming, and it looked like I was a monster and didn't know what I was doing, but I swear that doesn't happen to anyone else whose blood I draw. After we treated him really aggressively for this and he had huge improvement in symptoms, now when I draw his blood, it just looks like everyone else. It's just a little dot, maybe a little tiny bruise around it. But those biofilms create this, it's called hypercoagulable state where your body is clotting more than it should. It's almost like the infection, some of the biofilms, depending on what they're made of, it's like you've got little clots throughout your body that have all of these trapped in there. So TLAB, I think, is an amazing option as far as insurance coverage goes. So they are now Medicare approved, which opens the door for some insurances to reimburse. And they are the ones I referenced that are accredited by the College of American Pathologists, which is really high. They had to do a lot to get that. That speaks volumes for its accuracy and the quality of like scientific rigor and work that they do. So what I've seen come back, nobody's insurance is paying for it outright. Some insurances are reimbursing, and it just depends on the company. I called TLAB a couple months ago and asked them what they were seeing, and they said it's just varying from, from company to company because they are newer. But the people who did this, Dr. Robert Mosiani and Marna Erickson, they've been doing this for a long time as scientists, and it's the best of the best, in my opinion. So then one may ask, why would I ever not do that testing? I think there are a couple of scenarios where that wouldn't be your first choice. My other preferred specialty lab for these infections is IGeneX, IGeneX, and you can find them at IGeneX.com. IGeneX has been time. They actually got like FDA approval recently for a direct to consumer Lyme test that uses their testing. A little rant about when people say, well, those labs aren't FDA approved. There are a lot of labs that your normal provider orders that aren't FDA approved. I get lab work back from LabCorp and Quest. It'll say, this test has not been evaluated by the Food and Drug Administration. It doesn't mean it's not a good test. We do that all the time. FDA approval is not required for all labs at this point and not for labs to be covered by insurance. What you want to look at is the scientific rigor behind the development of the tests, their quality control standards, their record. So IGeneX does mostly indirect or testing, antibody testing. They do have some fish testing and a few direct methods available for some of the tests. They don't send you the beautiful pictures that TLAB does, but that can be part of their panel. Times that I choose IGeneX for people, I'll throw you a few scenarios. And I use both of these tests frequently. IGeneX is a great screening lab when we're trying to figure out what's going on and we have to cast the net wide. TLAB does Borrelia, Bartonella, Babesia, They're biofilms. You can do blood or you can do skin tissue biopsies, which is sometimes how you find Bartonella, but they do not include Anaplasma, Ehrlichia, Rickettsia. IGeneX does all of what I typically recommend if there's someone I need to cast net wide on is I do IGeneX. Do their TBD, tick-borne disease panel 5 1B. The reason I choose that as a screening lab, it's got robust antibody testing for Lyme disease and other Borrelia strains. It has it for Anaplasma, Ehrlichia, Rickettsia, Bartonella, and Babesia. But then it also includes a fish panel for the Bartonella and Babesia because I have had patients with that test and even people who weren't immunocompromised, but antibodies are negative, but we have a positive fish. The nice thing about the panel is it is heavily discounted if you purchase it as a panel versus like just trying to say, well, I want to save, so I'm going to do this, I'm going to do that. The panel does save you money. And if you're somebody who's worked a lot with animals or has been sick a long time, then I think doing the big panel makes sense. And I'll tell you why. If you have Anaplasma, Ehrlichia, Rickettsia, but you don't have Lyme disease, you your provider wouldn't have a reason to necessarily treat with doxycycline. So doxycycline is an antibiotic commonly used for Lyme disease. It is not effective against Bartonella. It has minimal effects against Bartonella. So if you just tested, say, for Bartonella and Babesia, you had Bartonella and Babesia, but there was actually Rocky Mountain spotted fever there or anaplasmosis, and you didn't catch that with that big screen, you wouldn't be getting doxycycline likely, and you could be missing part of what's keeping you sick. Those infections I've found they're not as easy to treat as people would like to make them think. If you don't catch them at the very beginning, it's not going to be 2 weeks. It's going to be longer than that to get clear. But relatively speaking, it's a little more straightforward path clearing those than it is the Bartonella and Babesia, which if you think about what they're doing, they're incorporating themselves into your body's anatomy. That's why this takes time to get better, because if something has made itself part of your red blood cells and part of your blood vessels, we can't just like snip those off, knock them out. Like it's going to take time. You're talking about like demo, remodeling, reconstruction, renovation sort of project. So casting the net wide, if you do have a background working with animals, which we have a lot of um, farmers, people who keep animals, we have a lot of Amish patients, in that scenario, unless there's an autoimmune disorder, I kind of go with the panel because I don't want to miss anything. But if you are immunocompromised, and honestly, once you get to a certain age, if you're like 70, not that that's old, but it's older than you used to be, your immune system's not working the way it was when you were 20, you may just want to go more with that direct testing so that nothing's missed. I have a family member, well, and one more bonus for IGeneX. If somebody has traditional Medicare, and we've talked about this before, traditional Medicare with a supplement plan, bueno for a lot of these tests. Medicare Advantage, disadvantage for these tests. If somebody has Medicare traditional, I always will do IGeneX first because Medicare actually pays for it 100%. And so I'm 100% going to do that. But I'll give you a scenario about how I stack them. So I had a family member who's older. I had suspected some of these infections for a while, but they were kind of hesitant about it. Found out there was a regular Medicare plan. It could be just paid for 100%. Came back, IgG positive for Bartonella, and this person has rheumatoid arthritis, fibromyalgia, osteoarthritis. My clue that infection might be playing a role is when they were being treated with IV antibiotics for another infection, they had some die-off symptoms where there was flushing and chills and everything, but then a huge improvement in pain, even though they were being treated for a respiratory infection. So I'm like, that doesn't happen if you don't have some sort of deep entrenched infection. So anyway, get back. antibody positive, but that's not a direct test, and I wanted to be certain because embarking on treatment for someone who's elderly, I wanna know that it is still there. So then I stacked and ordered TLAB on top of that for verification that you could locate the bacteria, so that because when somebody has lots of specialists involved too, I feel like you wanna even more than usual do your best testing, best documentation. So people say, "Why are you doing this?" You can present them with, "Well, I had these tests done." So that's kind of a lot of rambling. But the point is you get what you pay for with labs, and I promise with these 2 tests, it's money well spent. I have myself spent and seen other people spend money on subpar lab testing, and you get subpar result. You just do. Like, these companies do a fantastic job. Like I said, the scientific rigor, quality control, they are both Medicare approved. Another lab that does a great job, specifically with Bartonella, is Galaxy Diagnostics. They have some really good Bartonella testing, but those are the ones that I really stick with because if I'm gonna have someone spend that kind of money, I wanna know that I can rely on the results that I get. So as far as getting the test ordered, if you for IGeneX, you can order a kit online. You do have to get a provider to really willing to sign the order, but if you have a healthcare provider who is willing to sign off on it, you can order the kit, they can sign the order, and then you can just take it to whatever lab is willing to draw it and send it off. It's been kind of hit and miss with my patients. I mean, once they're my patient, obviously, I'm willing to order these, but I know people have had a lot of frustration trying to find answers, and I would just with that, just encourage you not to give up. There is hope, you just keep looking. But also beware, this will be my last little caveat for the day, not to look at the world through lime-colored glasses is what I call it. Sometimes, because Lyme disease can cause so many different symptoms, people think everything they have is related to Lyme disease, and they wanna interpret every ache and pain, every piece of discomfort, every bit of emotional distress, discrimination, everything, like, through the lens of Lyme disease, and it doesn't account for everything. I'll give you a little personal example. I had with my babesia, I had a lot of really, really severe heaviness and tension in my neck, shoulders, upper back, obviously my head. Just struggled a lot for a very long time. Went through treatment. With treatment, things get worse before they get better, but then they were much, much better. And then I started having a little more of that. It wasn't the same, but I'm like, man, I've got tension in my shoulders. I'm feeling it in my hips now too. And there's this temptation to panic and think, oh my gosh, the infection's back, the infection's back. But then I did a little digging and found 2 things. I had a hysterectomy, so I didn't know exactly when I went through menopause, but I had menopausal levels of hormones. And then I also, through genetic testing, realized that I had impaired estrogen receptors, which can lower the available estrogen even more. And low estrogen can cause musculoskeletal stuff. And within hours of putting on my first estrogen patch, my pain improved. So I could have gone down this deep, dark rabbit hole looking for the hidden infection, talked about how it's impossible to get well and you'll never get better, blah, 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 blah. But there was more to it. There was more to it. So don't get tunnel vision. Don't get tunnel vision. Keep an open mind. Get good tests. We can post links in the show notes to TLAB, IGeneX, and Galaxy. And remember to have hope because you were made to be whole. Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.